First of all, hello to everybody, and it's a great pleasure to host this particular session as part of the Social Safety Net core course. It's great to see so many of our colleagues from the country, our client countries to be here, as well as our colleagues in the bank and our partner institute from the partner institutions. Today's session is about social safety net and gender. We are very happy to have a distinguished panel of experts, and we're also very happy to use this opportunity to share the latest research finding and evaluation report that was conducted by our impact evaluation group, which is the evaluation arm of the World Bank Group. First, just a few brief sentences about the topic, and then I don't want to spend too much time introducing since we have already been. This is the topic I understand has been discussed, has come up quite a bit in the safety net core course in the past few days, and so in many ways it has already been very much on the mind of participants and colleagues who are designing and implementing social safety net programs. Just want to make 2 points. First of all, social gender issue is really not one of a topic that we would want to check when we work on social safety net. It is really an integral part of what we do. And I think colleagues, when we design and assess the need for social protection, there is always a need to look at the gender aspect of it. What are the particular need and the vulnerability of of men and women, of girls and boys? So this is part of the need assessment that I think we all look at, but perhaps can do much more systematically. Second is that in the last many, I would say 2 decades, when we have together worked on social safety net and social protection in general, there has been a lot of experiment and a lot of learning already on how social protection interventions can impact, can improve the gender equity and help protect the vulnerable from this perspective. We know that there are significant evidence that has been accumulated about the impact intervention that are promoting gender equity and promoting the better protection of men, women, girls and boys, and the impact of intervening on mothers through the delivery mechanism would have a bigger impact on the kids. So there has been a lot of analysis and assessment on this. At the same time, it is still a topic that requires more learning, and as we being more innovative in looking at social protection interventions, safety net support for the poor and vulnerable, it is very important that we look into what we have learned collectively around the world. And this is what the study of the IEG was focused on. So the study was on social safety net and gender, learning from impact evaluation and World Bank projects. This was just published recently, and I think this is a great opportunity that we'll be able to learn from the evaluation together with our client. So today we have we are going to have Elena Bardasi from the IEG group to present the findings, and then we have a very distinguished panel to be facilitated and moderated by many. But first let me introduce Caren Groen. Caren is our Senior Director for Gender Cross-Cutting Solution Area in the bank. The cross-cutting solution area was established on July 1st, which is meant to facilitate and to support our overall gender work in every area that we work on. Caren is not only our Senior Director, but she also is a very internationally renowned expert on gender and gender issues in development. Prior to joining the bank, Caren was the economist in residence and co-director of the program on gender analysis in economics at American University. Between 2013 and 2014, Caren also led the UNU wider program and on aid effectiveness and gender equality. And from 2011 to 2013, she was the senior gender advisor and acting senior coordinator for gender equality and women's empowerment at USAID. So Caren will first give us a few opening remarks, followed by the presentation. And Manny, who is the director for IEG, will be facilitating the panel.
Good afternoon, everyone, and thank you to Elena and thank you to the practice for having me at this event. And I'm going to look forward to meeting as many of you as possible individually over the next few years. I've only been at the bank now for, it's my 3-month mark, and I realize how much there is for me to learn and hear from you. So, but I'm really excited about being here. And I'm excited about being here because I think that we're at an incredible moment of opportunity to actually harness a lot of what we're doing already, what we've been investing in, and bring it to a scale that we haven't had in the bank before. I have some remarks about social protection, but I just want to say one thing for all of us in the bank, that the gender cross-cutting solution area is the only entity within the new bank group, the global practices, the CCSA, that is formally charged to bring a new strategy on gender for the entire World Bank Group for approval to the board at the annual meetings in 2015. And as part of the strategy development, I just want to reiterate to all of you that this is not a strategy for the CCSA. This is a strategy for you in social protection and labor. This is a strategy for all of our GPs to come together to say, what is it collectively that we want to achieve, and how are we going to deliver that to our clients? So I think courses like this and other other events like this present us good opportunities to begin to have conversations that will be useful for us going forward. The first question, I just want to say 3 very quick remarks. I used to teach economics at American University. I used to teach development economics and a course on gender analysis and economics, and I always had modules on social safety nets. And it was very interesting for me to read the academic literature on this topic. And now that I'm in the bank, to actually read the IEG evaluation, which coincides with some of the academic literature on the topic, although there are some differences. So I thought I'd give you just a few reflections on why safety nets I think are important from a gender perspective, what are some of the key issues, very, very briefly, and then the importance of IEG reports like this and what we as the World Bank Group can do in response to IEG. So I think safety nets are critical in all of their diversity, whether they are focused on particular types of programs like conditional or unconditional cash transfers, whether they're public works programs, and I know that there's a big debate about public works, other kinds of social protection, pensions, all of those kinds of issues are enormously important for societies, and they're enormously important for thinking about how we reach our twin goals of shared prosperity and reducing extreme poverty. And what's particularly important about those from a gender lens is that when you understand the differences between males and females in their access, in roles and responsibilities in society, in how biases, often to the detriment of women, are unconsciously or consciously integrated into the design of institutions and policies, you need to have a gender lens on all of these issues. The fact, for instance, that women work often in many countries, don't work full-time, but work part-time, predominate in certain types of employment, informal as opposed to informal employment, has enormous implications for the way we think about pension programs and social protection. The types of inequalities that exist that prevent women from owning and inheriting certain types of assets, whether it's land or housing, are enormously important in terms, and given their participation in paid employment, combines in ways that may make them more vulnerable to poverty and may make it more difficult for women to escape poverty than men. Understanding all of these issues up front is critically important from a gender lens. So, and there's a fair amount of academic literature that I think many of you probably know as well as I, or better than I, on this topic. So then the question is, if we know this in the academic literature, how come we haven't always internalized it in the way that we deliver policy advice or we work with countries to design the range of safety net programs. And so one question and challenge for you is, how do we actually take some of this evidence and brainstorm about it and do better? There's two things in particular that I think are important from the policy and the actual delivery of the service itself that are important. The first is, clearly safety net programs are about improving human welfare and preventing people from absolute malnourishment and ill-being as opposed to well-being. And clearly we know that because of divisions of labor within households, women's roles in taking care of people are incredibly important. And so one of the things that was interesting to me about the report that Elena and her colleagues authored is how much of the social protection work that we do in the bank has focused on women in their roles as mothers and in providing that social welfare, the welfare function. But what's also important, I think, is how we figure out how we help give women the opportunities to be productive contributors in key ways through participation in labor markets, ownership of assets. So it's not just women as mothers, but how we actually think about women as economic actors. And social protection programs have not always had the goal of facilitating or increasing women's access to productive resources or ability to participate economically. I was in the conversation with the Mexican officials who came a few weeks ago to talk about how Oportunidades, which turned into Progresa, which is now Prospera, is doing some really innovative things on women's moving away from just thinking about women in their roles as mothers to give women opportunities to either start enterprises or participate in really productive ways. So I think one of the things that we should think about, and this is a challenge going forward, is how we can think about this dual goal of providing just the basics of social welfare, but think more specifically and deliberately about how we also increase the economic empowerment, economic potential of programs. And in that regard, we need to think about economic and social roles in all of their complexity across the life cycle, and I think that's really important. So starting from, because they change across the life cycle, and there's different implications. And different programs, when we think about them as a global whole, pensions are for one part of the life cycle, but we have to be thinking early on about the range of programs when women are young and so forth in terms of employment and other things. So one of the things, how we get there is things like this kind of report that we're going to hear about from Elena Bardasi, and the lessons that I think this report pulls together in terms of what we've learned more generally from the literature, but an evaluation of our own portfolio, which suggests to me that if we were to take a hard look and have really good focused discussions on this, we could as a group identify where we've had some missed opportunities, and we can identify areas for experimentation going forward. And as we think about the areas of experimentation, like what the Mexican government is doing and some of the things that are happening in other countries that are similar with the empowerment approaches, we can be thinking about doing a better job in two areas. The first, and this is very close to my heart, is in the range of basic data collection. It's shocking to me, and our shareholders have looked at this, how to this day little sex disaggregated data we are not just not collecting, but not aggregating and using and reporting. That is just, in any program that has individual level beneficiaries, to not collect the sex disaggregated data is a travesty, and we need to do better at it. The second is really thinking about impact evaluations of what works. And if we have an upfront goal of saying that, well, social protection, we can also do more to empower women, and that's an upfront objective, we can be thinking about the range of additional outcome measures that are important to see that we're, whether or not we're delivering on. So for aiming at empowering women, maybe we would collect information that actually tries to measure empowerment more directly, as opposed to relying on proxies like whether income was increased or not, to looking at use of income and other kinds of things. And this report makes a lot of recommendations for how we could do better at monitoring and evaluation and using impact evaluation. And in this respect, we have the Gender Innovation Labs at the World Bank that I think we could really draw upon and bring in here to help us address some of the unanswered questions. So I guess in sum, I want to congratulate the team that put this report together. And I have to say that now that I'm in the Gender CCSA, I'm the recipient of some IEG reports that are not entirely flattering to the gender group, but I see this as an incredible opportunity to learn from our independent evaluation arm for what we can do better. And I'm hoping that the social protection practice can learn from the independent evaluation group as well for what they can do better as well. So let me now turn to introducing Elena Bardasi, who is the lead author on the team who prepared the report that you'll hear about, Social Safety Nets and Gender. Elena is a senior economist in the World Bank Independent Evaluation Group, and she does lots of things there, but she focuses on the gender impacts of social protection for poverty reduction. But I've known Elena for a very long time, and I know her more for her work on female entrepreneurship and female employment, and I've really loved working with her over the years on those issues. She used to sit in the gender team. It's our loss and IEG's gain that she's with you now. But she's done a lot of things since she's been at the bank, including contributing to the Africa Competitiveness Report and several investment climate assessments. And Elena, I'd like to welcome you to the podium and tell us about some of the tantalizing findings as a result of your portfolio review. Thank you.
Thank you, Caren. Thank you, Xiaoqing, and all the organizers for this course. Good afternoon, everybody, and I know this is a very intense course, so I particularly appreciate sharing your lunch with this report that has been launched today, actually, so it's very fresh. It's the first time we present it. So during my presentation, I'm going to do two things. I'm going to show you some of the findings that we present in this report. This is the overview. You'll probably receive one copy. But I also would like to derive some implications, practical implications for your work on the field as practitioner. So you might think that we do already a good job in integrating gender. No, after all, conditional cash transfer often give the transfer to the mother, to the woman. Public works have quotas. So are we really doing a good job in that? So this was a question that we had in our mind as we were writing this report, and we were reviewing all this evidence from the literature and also looking at the project that we do at the bank. So, of course, in the limited time I have available, I can't go through all the findings of the reports. A lot of nuances, a lot of information. So what I will do, I will guide you through three main findings, and for each one I will try to derive some implications that are more practical for projects. So the first finding, not everyone in this household benefits equally by social safety net. So if we accept that men and women have different roles, as they do, different access to resources, different constraints, different assigned roles, of course their incentives are going to be different, their preferences, their needs. And so we shouldn't expect that they benefit the same, even from intervention that target a household. And I'll give you three examples. One is from education, CCTs in this case. So CCTs are supposed to support attendance and enrollment of children in the household, but clearly the response of boys and girls to CCTs is going to be different. And this depends, for example, on differences in the value of their time, in the opportunity cost of their time. Boys and girls work when they do, as they often do, work in different activities. Girls more often in domestic work, boys more often in paid employment, not everywhere, but of course all this determines the compatibility with attending school and the value of their time. At the same time, also parents, when they make decisions, they might think of their earnings as adults. And here also, gender differential in the future may drive different decisions of the parents with regard to their children's education. The second example I would like to give is employment through public works. For women and men, public works has different role often. For women, often public works represent an opportunity in alternative to being out of the labor market or being in a specific female occupation, while for men, this might represent an option in hard economic times. So what we have observed in some cases is that in Argentina and India, for example, is that participation of women in public works is facilitated in procyclical, it's a bit procyclical in the sense that when men find other opportunities outside of the schemes, this facilitates the entrance of women into public works. There is also some evaluation evidence that have shown that planned jefes in Argentina have become more feminized over time, indicating that also the transition out of the scheme might be very different, might work very differently for women and men. The final example I'm going to give is non-contributory pensions. In this case, the scheme itself, as Caren was alluding before, is per se female-friendly, if we want to say so, because women are less likely to accumulate savings, they are less likely to accumulate formal pensions, for example, during their life cycle. So definitely, even a scheme that is so neutral in theory, like related to age, can have a very different meaning for men and women. So what are the implications? Well, of course, we have to consider all these gender differences, and we have to consider it at the design stage when it is important to identify upfront all the possible impacts and drivers of these impacts that are very gender specific and address these in the project. CCTs give some examples. CCTs start to change a bit and they vary in the way they are designed. What we found in the published literature is that sometimes we need to target the girls explicitly. We found examples in Cambodia and Pakistan, for example, in order to facilitate girls in particular. There are schemes that propose different payments for boys and girls. More recent evidence from Africa shows that we might think about the role of the conditionality in supporting girls better. So this has to be assessed in context, of course. And during implementation, of course, we need to collect data. We need to track the gender dimensions that are important in order to understand who are the beneficiary, how they benefit, and also to make correction in the course of the project and address upfront what could have been potentially unintended impacts. The second finding that I would like to talk about is actually divided in two parts. So parts one, so the assumption about mother's role in improving, in making children better off needs to be tested in context. Projects, or for a long time, we always assume that it's better to give the transfer to the woman. And projects use this in a quite instrumental way. However, it's surprising, there are not a lot of studies that actually prove this assumption in a very rigorous way. There is a study for Progress. There are some other evidence from Latin America, but frankly, it's not a lot of studies that are really able to prove this, partly because there is a lot of other things that are happening that also go in the same direction and are technically hard to take into account, but is less frequent than we think. The other thing is that the more recent evidence from Africa, as I was mentioning before, Burkina Faso, Morocco are two examples, are showing that the conditionality can actually work better if we want to improve outcomes for girls. This has been shown for a visit to health clinics in Burkina Faso, for school outcomes in Morocco. Then this assumption might not even hold in some cases. So we don't know. I mean, so far we don't have really evidence that giving money to the mother is worse in a, what I'm saying, in a very academic sense. But actually, you might think that there are a lot of situations where it's actually wrong, and we should probably target the father instead. We think about polygamous household, for example, or situations where it's the father that is in charge of making certain decisions. So the second part of these findings, and this is probably something that gets a little bit close to what Caren was alluding to, is that the impacts of CCTs on mothers as women, Caren said as economic agent, need to be better understood. So we think of women as mothers, but probably not as much as mothers as women, in a sense, adult women. Do CCT empower women or not? The literature has focused a lot on consumption decisions that women make, but this is not necessarily empowerment. This is a dimension that is basically functional to the children's welfare, but we don't know exactly if this is the case. What are the costs of administering the benefit and enforcing the conditionality? This has typically been a feminist criticism to the CCTs that I believe is taken more and more seriously in a wider sense. But it's surprising we still don't have evidence on this. And actually we found one project that reported one piece of anecdotal evidence that perhaps the CCT, administering the CCT, was not very compatible with women employment, and the women had to do a lot of things to take care of it. So what are the implications here? Well, first, assess who is the best recipient of cash transfer. And here we have this recent evidence coming from Africa, where the transfer is given to the woman or to the man, and we can directly compare. So this makes things easier in order to understand more rigorously what is the impact, and we have some new findings about it, as I was mentioning before. And then something that is not done is really tracking the cost to the mothers of administering the transfer and other costs that might be attached to the management, if you want, of the social safety net. Finding number 3. This is a question that we like to answer, but we like to ask, but so there might be conflicts between poverty reduction and empowering women. So the main goal of a social safety net is to reduce poverty. Can they also empower women, and are there conflicts between these two goals? There is some evidence with respect to fertility and domestic violence, or at least this cost on the side of gender equality have been identified, and there have been studies that have looked at both of these outcomes. And the findings are reassuring in the sense that it doesn't appear that conditional cash transfer, for example, cash transfer increase fertility, conditional cash transfer mostly, and partly is because of the design of the project is trying to introduce a disincentive for this to happen. Domestic violence has been studied more recently, and so far we also don't have in this case evidence that there is an increase in domestic violence associated with more resources going to women. But this is very recent and very partial. So what are the implications? We need to test more on possible conflicts in order to improve project design. I already mentioned that the fact of recognizing upfront a potential cost in terms of fertility has allowed to introduce features in projects to limit this potentially negative impact or to manage it or address it. For domestic violence, we need definitely more investigation, and probably we need also different types of evaluation than just a quantitative type of evaluation. So we need more mixed method evaluation and probably a broader approach. On empowerment, again, this is probably an area that has been overlooked. We need to know more about the cost in terms of women empowerment, or which type of dimensions of empowerment can be enhanced by certain schemes and others might be diminished. And finally, we have also an example of the other way around, if you want. Quotas are very often introduced to promote female empowerment or female employment as, access to employment, but the question is, this limits the decision of the household in terms of like who's sending to work. So are these really needed? Where do they have to be set? At which level? What are the implications that they might bring with them? And also in terms of public works, also other costs might exist in terms of like alternative activities that of course people can't accomplish while participating in public work scheme, that this is also a cost that needs to be better taken into account. So to conclude, I hope that by now, after this very short presentation, you are convinced that gender impacts are complicated. It's not that a mechanical exercise to integrate gender into project. All these drivers needs to be well thought upfront in order to be addressed in project, and in so doing, do a better job in reducing poverty and hopefully advance gender equality. Thank you.
So good afternoon. I'm Manny Jimenez. I'm Director of Public Sector Evaluations here at the World Bank Group.